Good afternoon. Thank you so much for joining us. This is the Tuesday, April 14th update of the Riley County coronavirus response. We have a few guests with us here today. You'll hear a brief statement from local health officer Julie Gibbs first, and then we'll have some time for questions and answers with Riley County Police Department Assistant Director Kurt Muldrup, as well as Riley County Emergency Manager Pat Collins. You should probably recognize him from last year's flood response. But we will begin with a statement from Julie.
All right, thanks Vivian. Hi everyone. As of today, April 14th, Kansas has 1,426 positives statewide, with 327 hospitalizations and 69 deaths. Riley County now has 23 confirmed positives, and 9 of those have recovered. The most current cases involve a 54-year-old female and a 32-year-old male who are both being isolated in their homes in Riley County. We have begun the necessary contact tracing for both of them. We are currently monitoring 20 individuals, and we have 9 tests pending. To this date, we have had 157 negative tests in the county. We have partnered with Westview Community Church, as their facility is now a central location for donated masks as well as a distribution point. They have many requests from businesses and other organizations in town, so please consider donating masks. You may drop off these masks anytime from the hours of 11 a.m. until 3 p.m. on Mondays, Wednesdays, and Fridays, or on Saturdays from 9 a.m. until noon. Their location is 615 Gillespie Drive. If you need to pick up masks, you may do so at those times. We are limiting 3 masks per family. This is for the whole county, not just Manhattan citizens or those that belong to that church. In accordance with CDC guidelines, we highly recommend you wear a cloth mask in the event where social distancing may be hard to maintain. This is to protect others and is a great way to show compassion for others, as well as to help stop the spread. We do strongly encourage business owners and managers to require employees to wear cloth masks to protect customers when social distancing may be hard to maintain. We are still encouraging anyone with questions or concerns to email us at rileycountycovid19@gmail.com. If you are experiencing symptoms, please call the screening line at 785-323-6400. We do have healthcare professionals available to answer those calls every day from 8 a.m. until 10 p.m. Again, that number is 785-323-6400. Please know that we are here to help you through this time. If you have concerns or questions, please don't hesitate to reach out to the health department. Our staff is here to help answer your questions and get you what you need. As we go through these challenging times, we can be reminded of how fortunate we are to live in such a strong community that supports each other to accomplish great things. Please continue to take care of yourself, check on your neighbors, and think positively. Thank you, and I'll now answer any questions you might have.
Julie, I have one quick question. Can you talk a little bit about who should be calling that screening line? I know the health department uses that for statistics and for contact tracing. So if you could elaborate on that a little bit, that would be wonderful.
Sure. If you're experiencing symptoms such as a cough, shortness of breath, or if you have a fever, please call that screening line. Those are common symptoms that we see with individuals who do have COVID-19.
And should it be people who have not spoken with a doctor? Should you call it even if you've talked with your doctor about your symptoms?
This should be your first step. So before you call your doctor, or before you go to KSTAT, if you don't have a primary care provider, we recommend you call that screening line. We do have healthcare professionals that are managing that screening line, and so they will ask you a series of questions, and based on your answers, they will point you in the right direction.
Excellent, thank you so much. This next question is for Pat, and I know Pat has had a long career here in Riley County and has been through quite a number of disasters. Can you talk about your experience with this particular disaster and how it might be different from things you faced in the past?
Well, Julie, over the years, and Vivian, a lot of the times we have disasters that come on us very fast. They happen overnight, and the next day we're in recovery. Several times we've had floods that came in. They build up over several days or weeks, and then we had a longer recovery. And I think what we're seeing here is the triggers that we use for some of those other disasters aren't there. And I think a lot of people are looking at this like they do with some of these other disasters. And I think the buildup for this has been several months. I don't think we're quite at the peak yet, and I think as we go on, the recovery will be quite extended. And I think that's the difference between some of the disasters we've had and some of the newest disaster we have here.
Pat, also, we have kind of another situation we're facing here in the Midwest, that this is the beginning of severe weather season. Do you have advice for people who might have concerns about that, or advice, steps people should take to make sure that they're prepared and aware?
Well, I think that's something we do every year about this time, and I think the last weekend was an example of how severe weather could be here, and we're at the beginning of that season, and it goes a lot of times it'll go on into June or July, and I had some calls just the last couple of days about, okay, should I go to the shelters? Should we open the shelter with the coronavirus the way it is? And to me, that's what people need to be preparing for. They need to be prepared to be in a shelter, be close to people, have masks, try to stay away from them, do the social distancing if you can. But, there's a lot of people out there that live in mobile homes. They live in apartment buildings. They don't have adequate shelter for the really severe weather, the tornadoes. So there are shelters around, and they need to utilize them and take that short-term safety methodology to task, and actually try to prepare for it early.
So for my 2 cents, and tell me whether or not you agree, Pat, that you kind of take care of the most immediate threat first. So if the sirens are going off, would your advice be to go ahead and go to a group shelter and then do the best you can to protect yourself?
I would, and I think right there you said it. You need to protect yourself. You can't count on other people to come in and have a mask on, or have their children with masks on. So you need to get ready for that just in case it happens. You might look at people around and talk to them, some of the neighbors that don't have basements or don't have shelters, and try to help them too.
Thanks for that advice, Pat. I appreciate it. In terms of wearing masks and just kind of the social stigma involved, we had somebody comment that they feel a little bit silly going out with a mask. Julie, can you speak to that a little bit? And I know we've been throwing around the idea of some initiatives to help with that.
Yeah, so I've been talking to some of the other local health officers and administrators in the state, and there's actually a challenge going on right now. It's a mask challenge to basically put it out on social media that we're all wearing masks, and this is what it looks like. And this may be the new norm for a while. So yeah, that's just one thing that we're thinking about doing, and I think it'd be a lot of fun. But you really do see a lot more of it now, and it is becoming more of the social norm.
With regard to wearing masks outdoors, somebody contacted me earlier today. There's someone who who works outdoors for their job, and they were wondering what your advice might be. They talk with people very rarely. Once in a while, they'll have a situation where it's difficult to maintain that 6 feet of distance because equipment is loud and they might need to speak with somebody. Do you advise them wearing a mask for the day, putting a mask on and taking it off, or what might be the implications for that?
I wouldn't advise putting a mask on and taking it off, especially if you're going to lay it down somewhere. We want to make sure that they're clean. So in that situation, if the person was able to maintain that proper social distancing and they weren't coming in contact with individuals, I'm not sure that I would wear a mask. Mainly the masks are for, protecting other people. And if you're going to be around somebody or a lot of people during your job, then that's when you should wear a mask.
Excellent. Thank you so much. We've also had some questions come in about garage sales. This is typically the time of year when folks clean out the garage. They might have some extra time at home to work on those kinds of projects. Are garage sales allowed right now under the stay-at-home order?
Garage sales are considered non-essential, so no. We advise that you hold off on that garage sale. I know I usually have my annual garage sale at the end of April, and I've had to push that out. So we'll keep monitoring the situation, but as of right now, they are not considered essential.
All right. This is another business question. So we know that barbershops, hair salons, and nail salons are all closed right now, but you see sometimes even on Facebook folks offering to come do those services in your home, and that does, can you talk about whether or not that violates the order, and should people be doing that?
Right, and yes, that is in violation of the order, mainly because of that social distancing. You're not able to maintain that 6 feet, so therefore we would not advise for that to happen. So highly recommend just to hold off and wait it out.
All right, thank you so much. Do we have any questions from the members of the media at this time?
Vivian, I have a question. This is Haley with the Manhattan Mercury. Julie, I was wondering if you know of where the 2 most recent positive cases where they live at in Riley County.
We don't have that information right now. We are making contact with those individuals.
Thank you.
Mm-hmm.
Anyone else?
This is Derek Simmons with News Radio KMAN. I had a question about pools. So with the cities announcing today that the closure of outdoor city pools this summer, do you anticipate we'll see more of those types of closures in residential neighborhoods or apartment complexes?
Yes, as of right now, we don't advise for pools to be open. Of course, it's too cold right now, but looking into the future a little bit, we want to adhere to the stay-at-home order. So as long as it's in effect, we want to keep those pools closed. We'll just have to see what our situation looks like, come June 1.
Thank you. Let's see. I had a question here. I'm sorry, I'm trying to follow up on my notes here. With regard to the child care facilities, do we anticipate extending or making sure that order is in place? And have we heard anything from the governor about her intentions to let her stay-home order expire or to extend that?
Yeah, as far as the governor's order, we do have a strong indication that that will be extended. We have not heard for sure, though. As far as the child care order, yes, we are looking at extending that. There will actually be an order issued tomorrow that will be put into effect on the 20th to extend those child care guidelines, which include taking temps at the beginning and end of every day and screening, as well as maintaining the groups smaller than 10.
Thank you. AD Muldrup, can you talk about what your officers in the field have seen out there today? Are people generally in compliance with the order, or can you give any updates about that?
Yeah, we, as I've continued or said all along, we continue to see great compliance, voluntary compliance by our community. This cool weather obviously helps with that. The staying at home and the desire to get out and do the activities decreases when it's colder out. So I'm sure we'll have a few more challenges as it starts to get warm, and I look forward to the warmer weather. So we'll take those challenges, but want to continue to encourage everyone to remember that when they're out exercising, to maintain that social distance and go out for the purpose of exercising. Saying group activities will be discouraged. They don't fit under the governor's order, but individual exercise programs are encouraged.
All right, thank you. Let's see, also wanted to ask, Evans, do you have any final comments? Oh, actually, yes, I'm sorry, I lost my train of thought, unfortunately. But Julie, I wanted to ask you about the amount of details we've been sharing with the public about each case, and maybe some of the reasoning behind those choices.
Yeah, we have to be very careful about the amount of details that we share about each one of our individuals. Our main priority is to protect the privacy of the individuals. So anything that might be leading to their identification, we want to steer clear of that. So that's why we are very careful in what we can put out.
And why might it be important for folks, who are experiencing symptoms and want to come forward, but might have some hesitation about that?
I'm sorry, what was the question?
Oh, I'm sorry. I'm having a little trouble with my microphone today. So, is it also important for people to feel like their identity will be protected, like kind of encourage people to come forward and get tested if they are experiencing symptoms?
Absolutely. Yeah, that's one thing that we really want to put out there, is that we will protect your identity. That's our number one goal. We don't want people to continue going to work even when they're sick and not get tested just because of that reason. So, yes.
I think that's an important point to point out, that we want to encourage people to contact their doctor when they have symptoms, to go and be tested. And when there's, like we even talked about with the stigma of the masks, there's a stigma of being one of the positive patients, obviously. So we don't want that. We want people to know that they'll remain anonymous, so to speak. Their medical privacy will be maintained, and encourage people to then not go to work when they have the symptoms, which will reduce the spread. And I understand the public's desire to know. That's why we've talked about, I think, regularly, of recognizing that it's out there. The spread is out there. We need to be cautious in all that we're doing, that we may be around someone that is positive for the COVID virus, and you just don't know it. It's also important that you may be, which is why you need to continue to practice that same social distancing in all circumstances, so that you're protecting others from potentially yourself.
Thank you so much. One final question, and I know this is a controversial issue for the community every year, but since I have you on the line, people are continuing to ask about burning in Riley County and whether adjustments will be made, whether things will continue, whether that has a bearing on public health, or if you have any comments to make about that, that would be appreciated.
Well, in the county itself, we're over the hump. We're on the downhill side. Most of the burning is done. One of the issues we have as we get farther into the season or past the season, there'll be more green grass. So what little burning happens will cause more smoke. One of the things, though, we do want to make sure that people understand is that on some of those days where it looked like there was a fog in Manhattan and in Riley County, most of that smoke wasn't coming from people within the county. Most of it was coming from those counties south and east of us, clear down to the Oklahoma border. It's something that the farmers in the Flint Hills need to do. I'm not going to say they need to do it every year, but most of them have a regular schedule that they do that to do a couple different things. One is to get the cattle in and get it in the pasture by May 1st. So they have a time frame they have to stick with. So the more or the later the spring hangs on and the wet weather hangs on and keeps them from burning, the more they tend to burn in 1 or 2 weeks, right there at the end of March and the 1st of April. The other thing is it takes that those cedar trees and burns those up and the sumac and the things that the cattle can't eat, and burns that out of the pasture, so it gives them more feed for their animals. So there's a really big reason why the people in the Flint Hills need to burn, and there's a specific time that works better for a lot of them.
You know, Pat, and I've also heard you mention in the past reduction in wildfire danger. As you know, we're vulnerable to lightning strikes and dry grass. Is that also a consideration?
Well, it is. One of the things that all the burning does is it keeps that grass down, brings up new grass. It's green. We don't have that leftover that would catch and actually cause a wildfire that would do damage to houses. So they're doing some really good out there, and I know there's a lot of people that don't like the smell or adversely affect their health, but it's hard for us to say they can't burn when the governor says it's just a recommendation.
All right, thank you so much. I want to thank you all for your time today. Thanks for answering our questions. Are there any final questions from the media or any other statements that any of you would like to make?
This is Derek from KMAN again. I just had one last question. So we're up to 8 recoveries now locally. Can you talk about how severe the symptoms were when they were initially diagnosed?
Yeah, so luckily we've been seeing a lot of younger individuals that have so far been pretty healthy. And so symptoms have been pretty mild overall. So that's one thing that we're thankful for. We haven't had, other than a few in the beginning, we haven't had anyone in the hospital, and even those that were in the hospital weren't there for an extended time. So we're very thankful for that. Symptoms do look a little different depending on the individuals, but so far they've been pretty mild in most of our individuals.
Okay, thank you very much. And thank you to everyone in the public. I know it's not easy to keep these safety measures in place, and you know, we're all looking forward to the time where we can get back to normal life. But again, all the choices we make now have a big impact, not only on our families, but on the community as a whole. So thank you for all the hard work you're doing with regard to that effort. And again, if you have questions, please let us know. We're here to help you find answers. And we'll be back again tomorrow at 4:15 with another live broadcast. Thank you.
Thank you.